Have you ever looked at a government policy announcement and thought, this probably doesn't affect me? Most people do. The problem is that some of the biggest changes rarely arrive with dramatic headlines or urgent warnings. Instead, they appear quietly inside lengthy regulations, administrative updates, and technical policy proposals that few people ever read. By the time the public realizes what has changed, many families are already feeling the consequences. That is exactly why staying informed has never been more important, especially for seniors, people with disabilities, and households that depend on Social Security, SSI, Medicare, Medicaid, or other essential programs. A growing concern right now involves proposals that could affect some of the most financially vulnerable individuals in the country. At first glance, the issue may seem complicated, filled with technical language and bureaucratic terminology. But when you break it down, the impact becomes very real. For many people, it could mean less financial support at a time when every dollar matters. To understand why this matters, it helps to understand how SSI works. Supplemental Security Income is a program designed for people who have very limited income and resources. It serves elderly individuals, people with disabilities, and others who meet strict financial requirements. Unlike traditional Social Security retirement benefits, SSI is funded through general tax revenues rather than payroll taxes. Because it is a needs-based program, recipients must remain below certain income and resource limits to qualify. The reality is that many SSI recipients survive on extremely modest monthly payments. These benefits are often their primary source of income. They are not luxury payments. They are intended to help cover necessities such as food, shelter, clothing, transportation, and basic living expenses. Even with assistance, many beneficiaries struggle to make ends meet in an economy where housing costs, groceries, utilities, and healthcare expenses continue to rise. One challenge facing many SSI recipients is housing. Affordable housing is difficult to find in many communities, and individuals living on limited incomes frequently rely on family members, friends, or relatives for help. Some stay in spare bedrooms. Others share living spaces with loved ones who are willing to provide support when no affordable alternatives exist. These arrangements often prevent homelessness and provide stability for people who would otherwise have nowhere to go. In recent years, certain rules recognized that reality. If a low-income household was already receiving food assistance and still chose to help another financially struggling person by providing housing support, there were circumstances in which that assistance would not automatically result in a reduction of SSI benefits. The reasoning behind that approach was simple. If everyone involved was already facing financial hardship, penalizing one struggling individual for receiving help from another struggling household did not make much sense. Now, however, concerns have emerged that some of those protections could be weakened or removed. If that happens, certain SSI recipients could see their benefits reduced because of the value assigned to housing assistance they receive from family members or friends. For someone already living on a limited monthly budget, even a relatively small reduction can have serious consequences. It can mean choosing between food and medication, delaying necessary purchases, or falling behind on bills. What makes situations like this particularly challenging is that many people never hear about these proposals until decisions are nearly finalized. Policy documents are often written in highly technical language that can be difficult for the average person to understand. Terms, regulations, formulas, and legal references can make important changes appear inaccessible to the very people who are most affected by them. That is why public awareness matters. When citizens understand what is being proposed, they have an opportunity to participate in discussions, submit comments, and communicate concerns. Whether or not those concerns ultimately influence policy decisions, public engagement remains one of the few ways ordinary people can make their voices heard during the regulatory process. At the same time, many beneficiaries are facing additional challenges beyond proposed policy changes. Across the country, people report difficulties navigating benefit systems, understanding official correspondence, reaching government offices, and resolving administrative problems. These issues can be especially stressful for seniors and people with disabilities who may already be dealing with health concerns, mobility limitations, or financial insecurity. One area receiving increased attention involves continuing disability reviews. These reviews are designed to determine whether individuals receiving disability benefits remain eligible for assistance. While reviews have long been part of the disability system, procedural changes and administrative backlogs can create confusion for beneficiaries. Many recipients worry that a simple mistake on a form or a missed deadline could put their benefits at risk. For individuals who depend on disability payments, these concerns are understandable. Benefits often represent a household's primary source of income. Losing them, even temporarily, can create significant financial hardship. That is why beneficiaries should carefully review all correspondence, respond promptly to requests for information, and maintain copies of important documents whenever possible. Another growing concern involves scams targeting seniors and benefit recipients. Fraudsters continue developing new ways to exploit fear and confusion. Some impersonate government agencies. Others claim that benefits have been suspended or that urgent action is required to avoid penalties. These scams often rely on creating panic and convincing victims to reveal personal information or send money. Protecting yourself begins with recognizing common warning signs. Government agencies generally do not demand immediate payment through gift cards, cryptocurrency, or wire transfers. They do not typically threaten arrest over the phone for routine administrative matters. Whenever a communication seems suspicious, it is important to verify information through official channels before responding. Healthcare coverage remains another major source of concern. Millions of Americans rely on Medicaid and Medicare programs for access to doctors, hospitals, medications, and long-term care services. Changes to eligibility rules, funding structures, or administrative procedures can affect access to these critical services. For many beneficiaries, the concern is not necessarily losing coverage entirely. Instead, they worry about being moved into different eligibility categories that provide fewer benefits or require higher out-of-pocket expenses. Even relatively small changes can create financial strain for households already operating on tight budgets. Some individuals also qualify for programs that help pay Medicare costs. These programs can assist with premiums, deductibles, and other healthcare-related expenses. When eligibility changes occur, beneficiaries may find themselves responsible for costs that were previously covered. The financial impact can be significant, particularly for those living on fixed incomes. At the same time, many people approaching retirement continue to face important decisions about when to claim Social Security benefits. Retirement planning is rarely straightforward. Health conditions, employment history, savings, family circumstances, and financial obligations all influence the best course of action. Some individuals consider claiming benefits as soon as they become eligible. Others choose to wait in order to receive larger monthly payments. There is no one-size-fits-all answer. What works for one household may not work for another. Understanding the trade-offs involved is essential for making informed decisions. Disability benefits add another layer of complexity. Many people assume that a medical condition alone determines eligibility. In reality, work history requirements also play an important role. Individuals must generally meet certain insured status requirements based on their employment records. This can create confusion for people who have been out of the workforce for extended periods and are uncertain whether they still qualify. Survivor benefits present another area where misunderstandings are common. Family members coping with the loss of a loved one may not fully understand what benefits are available to them. Eligibility can depend on factors such as age, marital history, work records, and filing decisions. Because the rules are complex, many families struggle to navigate the process without assistance. Spousal benefits also generate frequent questions. Some individuals believe they must choose between their own benefits and those connected to a spouse. In many cases, the actual rules are more nuanced. Understanding available options can help families maximize long-term financial security. Another topic that deserves attention is the relationship between disability benefits and employment. Many disability beneficiaries want to work if their health allows, but they fear losing access to benefits and healthcare coverage. Work incentive programs exist to address those concerns by allowing individuals to test their ability to work while maintaining important protections. These programs are designed to encourage independence and workforce participation without forcing people to choose between employment opportunities and essential medical coverage. For many beneficiaries, access to healthcare remains one of the most important factors influencing their ability to maintain employment. Housing affordability continues to affect millions of households nationwide. Rising rents and limited housing availability have created challenges for people across all income levels, but the burden is particularly severe for those living on fixed incomes. Seniors, people with disabilities, and low-income families often find themselves spending a significant portion of their monthly income on housing alone. As a result, family support networks have become increasingly important. Relatives frequently provide housing assistance, transportation, caregiving, and financial support. These informal arrangements help fill gaps that public programs cannot always address. When policies affect how such assistance is treated, the impact extends beyond individual beneficiaries and reaches entire families. Information sharing also plays a crucial role in helping communities respond to emerging challenges. Individuals often identify problems long before they appear in official reports. Whether it involves benefit delays, confusing notices, administrative errors, healthcare access issues, or local program changes, community awareness can help others prepare and avoid similar difficulties. At the same time, accuracy matters. Misinformation spreads quickly, especially online. Beneficiaries should seek information from reliable sources and verify claims before making important decisions. Acting on incorrect information can sometimes create additional problems that are difficult to reverse. The months ahead will likely bring continued discussions about Social Security, SSI, Medicare, Medicaid, and related programs. Policy debates will continue, and proposals will evolve. Regardless of political viewpoints, one fact remains clear. Millions of Americans depend on these programs every day for financial stability, healthcare access, and basic security. Understanding how these systems work is no longer optional for many households. It is a practical necessity. The more informed people are about potential changes, eligibility requirements, and available resources, the better prepared they will be to protect their benefits and make informed decisions about their future. As discussions about public benefits continue, many people are beginning to recognize how interconnected these programs really are. A change in one area can often create consequences in several others. For example, a modification to income calculations may affect eligibility for one program, which then influences eligibility for another. What seems like a minor administrative adjustment on paper can become a major financial challenge for someone living on a fixed income. This is especially true for individuals who receive multiple forms of assistance. Some people qualify for Social Security benefits while also receiving SSI. Others may rely on Medicare and Medicaid simultaneously. Many households depend on a combination of programs that work together to provide financial stability and access to health care. When one piece of that puzzle changes, the effects can spread throughout an entire household budget. For seniors, these concerns are becoming increasingly important. The cost of living continues to rise, and many retirees are finding that their monthly expenses grow faster than their incomes. Housing costs, insurance premiums, prescription medications, groceries, utilities, and transportation expenses all place pressure on retirement budgets. Even households that planned carefully for retirement often find themselves adjusting to unexpected financial realities. One of the biggest challenges facing older Americans is uncertainty. People want to know whether benefits will remain stable, whether healthcare costs will increase, and whether future policy changes could affect their financial security. Unfortunately, there are rarely simple answers to these questions because public programs are influenced by legislation, regulations, administrative decisions, and economic conditions that can change over time. Many individuals approaching retirement also struggle to determine the best age to begin claiming benefits. While some people choose to claim as soon as they become eligible, others delay in order to increase their monthly payments. The decision often depends on personal circumstances, including health, employment opportunities, savings, family needs, and life expectancy. For married couples, the situation can be even more complicated. Spousal benefits, survivor benefits, and retirement benefits all interact in ways that are not always easy to understand. A decision made by one spouse can affect financial outcomes for both individuals, particularly later in life. That is why understanding available options is so important before filing a claim. Survivor benefits are especially significant because they can provide ongoing financial support after the loss of a spouse. Yet many families do not fully understand how these benefits work until they are forced to navigate the system during a difficult period. Questions about eligibility, filing ages, benefit amounts, and timing often arise when families are already coping with emotional stress. Similarly, disability beneficiaries frequently encounter confusion regarding work incentives and employment opportunities. Many people receiving disability benefits would like to return to work if their health permits, but they worry about losing access to critical support systems. Healthcare coverage, in particular, is a major concern. For individuals managing serious medical conditions, access to treatment can be just as important as monthly financial benefits. Fortunately, certain work incentive programs exist specifically to encourage employment without immediately terminating benefits. These programs recognize that disability is not always a permanent, all-or-nothing situation. Some individuals experience improvements in health, while others may be capable of working in limited capacities. Providing opportunities to test employment without excessive risk benefits both individuals and society as a whole. Another issue drawing attention is the increasing complexity of administrative systems. Many beneficiaries report receiving notices that are difficult to understand. Others struggle to reach representatives by phone or encounter delays when attempting to resolve problems. While large public programs inevitably involve bureaucracy, administrative challenges can create real hardships when people depend on timely decisions and accurate information. For someone waiting on a benefit determination, a delayed response may mean postponed medical treatment, difficulty paying bills, or uncertainty about housing. Administrative efficiency is not merely a matter of convenience. For many families, it has direct consequences for daily life. Community awareness can help address some of these challenges. When people share experiences and information, they often help others avoid common mistakes or identify solutions more quickly. A person who successfully resolves an issue may provide valuable guidance to someone facing a similar situation. This type of informal support network can be particularly valuable when official resources are difficult to access. However, information sharing must be accompanied by careful fact-checking. Not every claim circulating online is accurate. Rumors, misunderstandings, and outdated information can spread rapidly. Beneficiaries should verify important information through official sources whenever possible and exercise caution before acting on advice from unverified sources. Fraud prevention also remains critically important. Scammers frequently target individuals receiving government benefits because they know those recipients may be concerned about losing assistance. Criminals often impersonate government employees, healthcare representatives, or financial institutions. They use fear and urgency to manipulate victims into providing sensitive information. Protecting personal information requires constant vigilance. Individuals should never provide social security numbers, banking information, passwords, or other sensitive details to unknown callers or unsolicited contacts. Taking a few moments to verify a communication can prevent significant financial losses and identity theft. Healthcare access remains another major concern for millions of Americans. Rising medical costs continue to affect households across the country. Even individuals with insurance may face substantial expenses related to prescriptions, specialist visits, hospital care, or long-term treatment. For low-income households, these costs can become overwhelming without assistance programs. Programs that help with healthcare expenses often provide more than financial relief. They improve access to preventive care, medications, and treatment that can significantly affect quality of life. Losing access to those services can create consequences that extend far beyond healthcare itself. Untreated medical conditions can affect employment, independence, and overall well-being. Housing insecurity presents a similar challenge. Stable housing is one of the most important factors influencing financial and physical health. Yet many individuals receiving benefits struggle to find affordable housing options. Waiting lists for assistance programs can be lengthy, and rental costs continue increasing in many areas. As a result, family members frequently step in to help. Parents support adult children with disabilities. Adult children assist aging parents. Siblings, relatives, and friends often provide housing or financial assistance during difficult periods. These acts of support help keep families together and prevent homelessness, but they also highlight broader affordability challenges affecting communities nationwide. Economic uncertainty has intensified many of these concerns. Inflation, rising living costs, and healthcare expenses have placed additional strain on household budgets. For people living on fixed incomes, adjusting to higher costs is especially difficult because their monthly resources may not increase at the same pace as expenses. This reality underscores the importance of financial planning and benefit awareness. Understanding available resources, eligibility requirements, and program interactions can help households make informed decisions. While no plan can eliminate uncertainty entirely, preparation can reduce risks and improve financial stability. Another important consideration is advocacy. Public programs affect millions of people, and policymakers often rely on feedback from constituents to understand how proposed changes may impact real communities. Individuals who share their experiences can provide valuable insights that statistics alone cannot capture. Whether through public comments, community organizations, educational outreach, or direct communication with elected officials, informed participation remains one of the most effective ways for citizens to contribute to policy discussions. Even when individuals disagree about solutions, understanding the practical consequences of proposed changes helps create more informed conversations. Looking ahead, it is likely that debates surrounding Social Security, SSI, Medicare, Medicaid, and related programs will continue. Questions about funding, sustainability, eligibility, and administration are unlikely to disappear anytime soon. As populations age and healthcare needs evolve, policymakers will continue exploring ways to address future challenges. For beneficiaries, the most effective response is often knowledge. Understanding how programs work, staying informed about changes, keeping accurate records, and seeking reliable information can make a substantial difference. While individuals cannot control every policy decision, they can take steps to protect themselves and prepare for potential changes. Families should also remember that they are not alone. Millions of Americans face similar questions and concerns regarding retirement, disability, healthcare, housing, and financial security. Community support, accurate information, and thoughtful planning remain valuable tools for navigating an increasingly complex landscape. Ultimately, public benefit programs exist because society recognizes that certain groups require additional support at various stages of life. Seniors who have spent decades working and contributing to their communities deserve dignity in retirement. People with disabilities deserve opportunities, healthcare access, and financial stability. Families facing hardship deserve pathways to assistance during difficult times. The future may bring new policies, new regulations, and new challenges. Yet the fundamental goals remain the same: helping individuals maintain independence, access essential services, and achieve a reasonable level of financial security. Staying informed, remaining engaged, and supporting one another will continue to be essential as those conversations move forward. No matter what changes occur in the months and years ahead, knowledge remains one of the most powerful resources available. The more people understand about the systems that affect their lives, the better equipped they will be to make informed decisions, protect their benefits, and secure a more stable future for themselves and their families. USA Retirement Guide.